very pleased to introduce this video about promoting living kidney donation within the Hindu community, produced by BAPS Charities. We have a very simple message for you. If you have a member of your family or a close friend who is waiting for a kidney, then we would request you to seriously consider living donation as an option, so long as your health is good.
My uncle, just out of the blue, offered me his kidney. I didn't even ask him. And it was a shock to me that he did that.
I've been suffering for the high blood pressure for 15 years, and there was after that there was a time that doctors said that either you go on a dialysis or you get a transplant, somebody who can donate the kidney to you. I didn't ask anybody, but my daughter Swati, she straight away thought about it and said that I would like to donate to my mum.
So I went along to clinic with my mum, which was the pre-dialysis clinic, and we got the option, like she said, of cadaveric donors, living donors, or dialysis.
Before operation I was fine and healthy, everything was normal. So I have no fear of operation or anything. Even after operation I am still healthy and working fine.
મારા ટ્રાન્સપ્લાન્ટ પહેલાં મને થોડી વરી થતી હતી કે સ્વાતિ પાસેથી મારાથી કિડની ના લેવાય, પણ પછી આફ્ટર ટ્રાન્સપ્લાન્ટ મને હવે ઘણું સારું લાગે છે, મારાથી બધી ફરી શકાય છે અને હું હેપીલી જીવું છું.
Every day I was on dialysis for about 5 to 6 hours at the hospital. I couldn't get permanent work because of the amount of time it takes, so I was only working part-time at the time. But as soon as I got my kidney, 6 months after I got my kidney, I got permanent work, full-time, which was good. And it was actually made me proud that I had full-time work at that time. I mean, I could travel. I have traveled since then because I couldn't travel before. And one good thing about afterwards is I've become a dad twice with a 6-year-old daughter and a 7-month-old son, which is fun.
It is something I would wholeheartedly encourage people to participate in, because ultimately I've given my mum back the gift of life that she once gave me.
Hindu belief universally is that we're not the body. And so therefore there are umpteen texts in all our scriptures which promote organ donation in essence.
So it's important for everybody in the Asian community to be aware of transplantation, in particular people with diabetes or high blood pressure or hypertension, because these conditions do lead to end-stage kidney disease, and so patients with diabetes or high blood pressure may at some point in the future need transplantation.
My view, certainly as far as scriptures are concerned, is that there's nothing stopping us actually doing living organ donation. As a matter of fact, it actually says Dan and Seva are the two key features of Hinduism, and Dan, organ donation, is probably the highest Dan one can do.
So transplantation compared to dialysis is a better form of treatment for end-stage kidney disease for those who are fit enough to have it.
When it comes to comparing living donor kidney transplantation to deceased donor kidney transplantation, there is a variety of advantages. First and most important is that the overall outcome of living donor kidney transplantation in the long term is much, much better compared to a kidney that comes from a deceased donor.
Regarding organ donation between living people, there's nothing in the scriptures, there's nothing that our spiritual leaders have said that tells us that we cannot be participants in this particular form of what we would call dan. Our Guru Pramukh Sai Maharaj used to teach us, in the joy of others lies our own. and he always promoted or propagated this way of living, of selfless service to others. And one of the most important things of dan or seva is not expecting anything in return.
Best dan you can give is the dan of the body, being selfless.
લાઈફ એટલે જીવતા હોય અને આપણા અંગદાન કરવું એ બહુ મોટી સેવા છે અને ખરેખર આને નિસ્વાર્થપણે આપણે કોઈ એની કિંમત લેવાની નહીં. એટલે સેલ્ફલેસ આપણે આ અંગદાન કરવાનું અને જે સક્ષમ હોય અને જે આપી શકતા હોય તો એ બહુ મોટી સેવા કહેવાય.
If you know somebody who has kidney failure and you wish to help, please come forward. Donating one of your kidneys is a very safe operation with excellent long-term outcomes.
My life is infinitely better since I donated my kidney to my mum almost 6 years ago, and I would do it again if I had a spare kidney.
If you know someone who needs a kidney and you're in a position to assist, you're in a position to help, then please do so and make it your dharma, make it your duty.